During the last year, each week, we have had up to 15, 16 now different agencies coming together to combat the opioid crisis. And I can really honestly say that in my experience as a physician and as Physician General and now Secretary of Health, you will not find a group of people more dedicated and willing to do whatever it takes to get resources to the communities to fight this crisis. And this has all been done under the leadership of Governor Wolf. And Governor Wolf is absolutely committed to addressing the opioid crisis. It's one of the priorities of the administration and certainly one of the priorities for our second term.
Our efforts to combat this epidemic were enhanced last year when Governor Wolf declared the opioid crisis a disaster. The Opioid Disaster Declaration, now in its 5th issuance, allows the administration to take unprecedented immediate action to work to reverse the effects of this crisis. In his declaration, the governor directed state agencies to focus on initiatives that enhance coordination and data collection to bolster state and local response, improve tools for families, for first responders, and for others to save lives, and speed up and expand access to treatment. We've learned a tremendous amount as a group. We've visited communities to find out what they are doing to combat the crisis on a local level, and we've also had various groups present at the command center. We've learned from the front lines, from educators, law enforcement officers, judges, coroners, researchers, and community workers. We've been visited by the federal government to share what we are doing and describe what resources we need to keep our progress going. Even earlier today, we were visited by representatives of the state of West Virginia who want to use the command center model that we developed to combat the crisis there. There's still a tremendous amount of work to be done. We collectively are dedicated to helping Pennsylvanians and saving lives.
While our efforts to combat the opioid epidemic began well before the establishment of the Governor's Command Center, I can say with absolute confidence that under Governor Wolf's leadership, the disaster declaration has brought forth the necessary departmental collaboration to help support and leverage all of the Commonwealth's resources to combat the epidemic and to help individuals throughout Pennsylvania who so desperately need and deserve our support battling this disease. We've made significant strides to provide access to treatment, to curb the availability of opioids, and to inform individuals about how to access services.
Recovery starts with a call. Pennsylvania's prescription drug and heroin addiction hotline is staffed by real people who are trained to help. They're there 24 hours a day, 7 days a week. They'll get you or your loved one into treatment, regardless of your access to insurance. If you or someone you know is suffering from addiction, call 1-800-662-HELP.
I'm glad you called. We're going to get you some help.
Paid for with Pennsylvania taxpayer dollars.